Lyme disease. You've heard the name before, but do you really know what it is? It's not just a rash or a tick bite, it's a bacterial infection that can seriously mess with your body if it's not caught early. Lyme disease is spread through the bite of infected black-legged ticks, also known as deer ticks. These tiny bugs pick up a bacteria called Borrelia burgdorferi from animals like mice and deer, and when they bite humans, they can pass it on. Most people get infected in the spring and summer, especially if they're hiking, camping, or working in grassy or wooded areas. The tick has to stay attached for about 24 hours to transmit the bacteria, so early removal matters. The disease usually shows up in 3 stages. The first stage, early localized, starts within a few days to a few weeks after the bite. The most famous symptom, a red expanding rash called erythema migrans. It doesn't always look like a bullseye, but when it does, that's a clear warning sign. You might also feel like you've got the flu. Fever, chills, fatigue, headaches, and muscle aches. If it isn't treated, the bacteria can spread in stage 2, called early disseminated Lyme. That's when things get more serious. Some people develop multiple rashes, facial paralysis, severe headaches, or even heart issues like irregular heartbeat. Then comes late Lyme disease. This can show up months or even years later. Think swollen knees, long-term joint pain, or even memory problems and nerve pain. It can be debilitating. So how do you find out if you have it? Doctors look at your symptoms, your outdoor activity, and sometimes they run blood tests, usually in 2 steps. But here's the thing. If you see the rash and you've been in tick country, many doctors will start treatment right away. In treatment, it's usually a course of antibiotics like doxycycline or amoxicillin. If you catch it early, most people recover fully, but some people aren't so lucky. Even after treatment, around 1 in 10 report symptoms that linger for months: fatigue, brain fog, pain. That's called post-treatment Lyme disease syndrome, and it's still being studied. So what can you do to prevent all this? Wear long sleeves and pants if you're headed into the woods. Use insect repellent with DEET. Check your clothes, your pets, and your body, especially the warm spots like your scalp, armpits, and behind your knees. And if you find a tick, remove it right away with fine-tipped tweezers. Don't twist it, don't burn it. Just pull it straight out and disinfect the area. Even celebrities get Lyme. Justin Timberlake recently shared that he's been battling it during his tour. He called the symptoms relentlessly debilitating, but he's kept going. The truth is, over 470,000 people are diagnosed with Lyme disease in the U.S. every year. It's not rare and it's not harmless. So remember, prevention matters. Catch it early, get treated, and don't ignore the signs. Because one small tick can cause a big problem.